Hi, I'm Frank Quinlan and I'm the Chief Executive Officer of Mental Health Australia, here to give you our quick 2015 budget night summary. The policy team here at Mental Health Australia have been in various lockups and have now had a quick analysis of the preliminary material out of the budget, and we're able to give you just a quick summary of the information that we have available to us as at now. Obviously, over the next few days we'll provide a bit more analysis, but I just want to take you through a quick introduction to the major measures in the 2015 budget. Firstly, we have the government recommitting to the announcement that they made something like a month ago now, or a few weeks ago now, to establishing a fifth National Mental Health Plan in an agreement with the states and territories, and in establishing an expert reference group to help guide their response to the National Mental Health Commission's report. We'll see that that expert group established over coming weeks. We're not sure exactly when, but the department have indicated to us that they think it'll be in the next couple of weeks that initiative will be announced. Incidentally, we also saw the National Mental Health Commission's funding renewed for another 3 years. You might have seen that there was some talk before the budget of a number of Commonwealth statutory bodies that might be wound up as part of this budget, but the National Mental Health Commission is not one of them, so they can continue their work. We also saw the Mental Health Nurse Incentive Program extended. That's a continuation of funding. It's interesting that that program appears to have moved out of being a time-limited program with sort of year-by-year extensions and into the main sort of corpus of funded programs. But it's also a bit hard, I say that with qualifications, because it's a bit hard to know exactly what that means, given that so much is going to be uncertain about the future of mental health funding over the next 12 months. I'll come back to that at the end of the summary. We've also seen in the main measures that they've announced $20 million in funding to the bush for mental health services and programs that goes with the drought support measures. So a welcome injection into those communities, but obviously the challenge there is getting the services onto the ground. A number of other measures across the health portfolio. There are real cuts, it seems, to mental health grants over the forward estimates. So we see that last year the government froze indexation across some 78 programs. They've continued that freeze in indexation now out to the 2019-2020 period. So that's a long time for programs to be frozen, and a lot of cost of living increases that aren't recognised by the funder. So there'll be, I think, continued pressure on services and programs in that sort of environment. But the health portfolio statements also reveal that the government will be, or anticipates it will be spending something like $34 million less on mental health services and programs over the coming 4-year period. Now that might reflect the very low CPI and some estimates there, but we'll be doing some investigation to try and get to the heart of exactly what that means. Again, in the health portfolio, we see the Mental Health Research Future Fund going ahead, and the government announcing that they're now starting to make some investment in research, actually spend some of that fund to advance the research program, and we'll be watching to see what funding gets invested into mental health research as part of that portfolio. You might have noticed before the budget there were some changes to the pharmaceutical benefits scheme that were announced. It seems these changes are not actually part of the budget per se, but a part of the negotiations that government is having with the sector. So a couple of drugs, duloxetine for depression and quetiapine, not sure on the pronunciation there, for a range of other mental health conditions, are the two drugs mentioned in that initiative. And it seems that what the government are doing is moving those onto a more generic footing. Across other portfolios, in social services, we see that the government have announced an actuarial approach to welfare. So they've invested $20 million over 4 years to do a detailed analysis of the ongoing cost to the country of operating the welfare system, and in particular looking at people with long-term dependency and high-risk dependencies and their cost to the budget. Now, we think this is a welcome initiative. Obviously, it'll need a bit more analysis and a bit more information, but this possibly overcomes one of the the really problematic budget rules which limits investment in the budget process to very short-term investments. This will aim to gather information about the long-term costs of various forms of disadvantage and dependency, and hopefully that will mean that the government will be free to invest in overcoming those costs. We've also seen an announcement for $37 million over 4 years to create a national gateway for carers information. We'll obviously be looking at that to see what sort of information that portal will provide in relation to things like the NDIS and what were formerly called Tier 2 packages, now called information linkages and capacity building, and the sorts of initiatives in mental health that affect carers. We've also seen announcements around the National Disability Insurance Scheme with a commitment to some ongoing activities and early rollout, things that are happening as part of the pilot process. But we've also seen a commitment from the government to $143 million to invest in the NDIA's information systems, their information technology systems. We haven't seen an investment yet in the sorts of IT systems that service providers and others might require to participate in the NDIA or the NDIS program. So we'll be looking for more information there. We've also seen a number of measures around youth employment. The Stronger Participation Initiatives for Job Seekers, as it's called, has actually moved away from the 6-month prohibition on receiving dole payments that was announced in last year's budget, and has brought that back to a 4-week waiting period. But a 4-week waiting period for all those job seekers that aren't identified as being at risk or as being principal carers or leaving state care. So the sort of exemptions that go with that, I think, are an important step in the right direction as well. There's also some significant investment in the youth employment area. The Youth Employment Strategy, as part of this initiative, government's going to spend $105 million over 5 years to improve access to employment, education and social outcomes for parents and young people who've been unemployed, including people with mental health conditions, people who've been refugees or people who are vulnerable in other ways. Again, I think this is an important initiative. It looks like what it's aimed at doing is tying together employment services, mental health programs and services, educational initiatives and others in a much more tightly wrapped service that's packaged around the individual in need rather than requiring those people to go from service to service. So we're looking forward to a bit more information about that initiative too. So overall, that's the summary of the main initiatives as we assess them tonight. We'll obviously do some more analysis of that over coming days. But I guess the summary message for us is that mental health is still waiting. We weren't expecting much from this budget because of the announcements prior to the budget, indicating that the government are committing to this process around the expert reference group and around planning with the states. It does create for us, though, an environment in which there's possibly a great deal of uncertainty unfolding over the next 6 to 12 months. Programs touched by the National Mental Health Commission's review of programs and services will be uncertain. They'll be going through that ERG process. A whole range of programs that are delivered by the states will be part of the state and Commonwealth negotiations around the National Disability Insurance Scheme, and then we have the National Disability Insurance Scheme itself rolling out programs. A whole lot of programs due to end notionally in 2016. The NDIS not really due to pick up the slack until 2019 and beyond. So really quite a significant period of uncertainty in the coming weeks. We'll continue to advance the argument for serious mental health reform. We think we need to get beyond the short-term cycle of budgets and elections and get to a 10-year agenda for mental health reform. As you know, we've recently seen the National Mental Health Commission lay out a significant part of that plan, including a lot of concrete actions that the government can take in the short term. So that'll be the continued basis of our discussions with government. We'll be looking to support from across the sector and looking, I think, to build on the sort of unity that we achieved early part of this year, with the sector really speaking with one voice on the need for reform and the key priorities that are to be addressed. So we'll be talking to you more about that in the weeks and months ahead, and I suspect by the end of this week we'll probably have a bit more analysis on some of those budget measures. But I hope that's been a useful summary for you tonight.